Hey everyone. So today we're looking at what ethical considerations we need to take when operating with other healthcare providers and looking at the DSM-5 model. Counselors operate in a wellness model when it comes to treatment, but there can be some benefits to learning and operating under the rhetoric of the DSM-5 system. Counselors often work with other members of the healthcare community. Understanding diagnostic codes maintains consistency when counselors have to coordinate, consult, or discuss referrals with other professionals in the healthcare field with whom we may have to establish a relationship. Um, we will, at some point, if in clinical healthcare, have to coordinate with other practitioners, whether they be medical practice or in psychological or psychiatric evaluations. Um, Depending on which facilities we also become employed in, we may be required to file reimbursements if we become approved providers, if clients have plans like PPOs. So, diagnosis can be a valuable tool in deciding treatment when planning interventions as well, since most are designed to fit certain diagnostic groups. Counseling methodologies are similarly adaptive in treating individuals based on their presenting challenges, but through a collaborative relationship with the client. Sometimes clients will see other practitioners who assign medications as well. So, something to consider. We want to uphold whatever process is actually helping the client. So, unlike the medical model, we also don't want clients to be defined by a diagnosis. Instead, we want to communicate and discuss the prognosis and steps they can take to move forward. When working with other practitioners and professionals, ethical consideration and issues are going to arise from diagnosing medical disorders. As stated before, counselors never want a client to feel defined by a diagnosis, and the word disorder itself can be incredibly isolating. Ethically, counselors should address the client's adverse feelings about a diagnosis and be prepared to discuss the topics to clarify what a diagnosis actually means. Unlike the wellness model of treating mental health, the DSM still focuses on promoting evaluations that emphasize medical problems and life stressors to diagnose clients' issues. There may not be anything wrong with that when it comes to medical treatment or medications, but we don't want that to be a veil hanging over the client's head. Um, in those cases, being well versed in the medical model can help counselors better understand and translate what that means for the clients. So it's kind of like an extra tool in the bag. Another ethical consideration is when managed care or healthcare plans deny coverage of services. Understanding providers' demands and completing healthcare forms while also developing objective and measurable goals in clients' treatment plans can help when we have to challenge denials for our clients, um, because we never want them to just get disapproved and never say anything about it. A lot of that reminds me of when Christ saw the people in need because the Pharisees and Sadducees were exploiting the poor. So he wasn't afraid to confront the corruption by literally turning over the tables in the temple. As counselors, we have to overturn poor judgments made by corporations that deny those people that are in need. Um, and although hopefully that doesn't happen on a large basis, we still have to remember and consider that might be a possibility. Thank you.